Good morning, everyone, or good afternoon, depending from which location you are joining. It is my pleasure to welcome you at this session. The session will be focusing on the region of Central and Eastern Europe. We are going to discuss the current status of healthcare in this, I think, very dynamic and also very diverse region. A big part of the discussion will be focusing on COVID-19 and the response of businesses and governments in the region. But I would also like to look beyond the current pandemics and would like to discuss the outlook and the opportunities in the market, in the healthcare sector. I'm not alone here, as Lee said. We have, I think, a very interesting panel here, and there will be 3 other panelists who will be joining me. The first panelist will be Dejan Pešić. He is the CEO at Medigroup. Medigroup is the largest healthcare system or healthcare provider in Serbia and wider region. It includes 15 medical institutions and employs around 900 people. The second panelist will be Richard Sands. Richard is the group strategy advisor at Medicover. Medicover is a specialized provider of diagnostic and healthcare services and is focusing on markets in Central and Eastern Europe. Medicover is very active, in particular in Poland and in Romania. The company operates through 2 divisions. The first focuses on diagnostic services and the other one on healthcare services. And the third fellow panelist will be Ilyan Grigorov. Ilyan is the CEO and co-founder at Darzalas Capital, which is an investment company or a vehicle investing in healthcare in Southeast Europe. You may know also Ilyan from his previous position. He was the co-founder and CEO of City Clinic in Sofia in Bulgaria. And for myself, my name is Tomáš Čihula. I will be moderating this panel. I'm a partner at Kinsteller. Kinsteller is a regional law firm that is present in 10 markets in Central and Eastern Europe and also in Central Asia. I specialized in healthcare and life sciences. And our firm regularly advises clients on various transactions in the sector, but also provides regulatory advice in the field. But now let's look at the issues the Central and Eastern European region is facing. So if we could move to slide 3, please. Thank you. Central Europe, I think it's important to mention that Central Europe is a relatively big market, a relatively big region. It is a market of around 125 million people and close to 30 countries. It's a very diverse region, as I said already. The 4 biggest jurisdictions are Poland, Romania, Czech Republic, and Hungary, which altogether have around 80 million people. It's a very interesting market for healthcare investors. I think there are plenty of opportunities for consolidation. And you could see in some specific areas that the consolidation is ongoing or is quite well advanced. We can give examples such as laboratory services or inpatient care in some countries, but there are also other sectors. So we will talk about it perhaps later. If we compare the market, the status of healthcare in Central and Eastern Europe to Western Europe, we can say that the average healthcare expenditure is rather low or lower, but it is growing faster than in the more established Western European countries. Also, we can see that the share of private out-of-pocket spending is relatively high because there are quite a lot of private healthcare operators. But again, I mean, the situation varies country to country. Okay, if you could move to slide 4, please. Now let's look at the impact that COVID-19 had on the sector. I mean, we could hear throughout the other sessions focusing on the other regions at this conference that the impact has been quite significant. Especially hospitals had been impacted, and they suffered a lot. There had been a huge demand for their services, especially as regards inpatient care or intensive care. But there were also other healthcare providers, smaller or bigger ones, who have been impacted. If you look at numbers, I mean, very rough estimates or numbers, we can say that, for example, as regard dialysis or elderly care, the impact has been relatively limited because simply this type of healthcare services continue to be provided. But other healthcare providers, such as, I don't know, imaging or elective procedures in hospitals or dental care, they suffered quite significantly because this type of service might be delayed, and many patients, they elected to stay at home and not to undergo their procedures. Also, I mean, laboratories, although, I mean, everybody who were potentially positive for COVID had to be tested by laboratories. Also, because people didn't visit their practitioners, laboratories had seen a drop in testing, and that's why a drop in revenues. We can discuss later how the situation looks at the moment. In general, we can see that as a result of COVID-19, the spending has increased. And we think that as regards healthcare sector, the spending will continue to increase because people will care more for their health and they will be willing to spend more money. The question is if also the public healthcare system will be able already to allocate more money for healthcare, because the economies in Central and Eastern Europe, like the economies in other countries, will be obviously under a very big pressure, and there has been a drop in general GDP. So we need to see. Okay, if we move to slide 5, please. Another interesting feature that has been brought by COVID is obviously that there has been an increased demand for home care. We could see a lot of providers, home care providers, expanding their activities, and that's, I mean, naturally related to COVID-19 because people prefer to stay home, that they were stuck at home. Also, there's been a big discussion regarding healthcare, and we could hear at the other panels as well. Healthcare has been a big topic, has been used a lot in other countries. I think in Central and Eastern Europe is a bit behind. There are some jurisdictions or countries that made use of it, and also the government supported use of e-health services, such as, for example, Hungary. There are other countries that have been relatively slow and I think very conservative. Also, as regards personnel, people who are employed in healthcare, I think that has been a big topic in a number of countries, because these countries in the past years, they experience so-called brain drain. I mean, many people left for better paid jobs in Western Europe, and there had been a shortage of personnel already before COVID-19. And this has been only exacerbated by the crisis, and that there has been a shortage of personnel. Also, many people, many staff got infected. They had to stay at home with their kids, for example, and also in some countries, staff from private healthcare operators have been asked to serve in public hospitals or public facilities, which again made things worse for healthcare providers, especially private healthcare providers in many countries. Let's move to slide 6. maybe looking beyond COVID-19, what are the opportunities that we can see, or what are the trends? And this is definitely also one of the topics we are going to discuss on today's panel. We can see already now an increased interest in the healthcare sector amongst investors. We can see private equity funds or private investors looking at potential targets in the sectors, and investors who previously didn't look at the sector, didn't think about opportunities in this sector. Now they are trying also to specialize in healthcare and look at opportunities, and we think that this trend will continue. Apart from a few maybe large transactions, we think that the transactions that will occur in the market in healthcare in Central and Eastern Europe will be, say, mid-sized deal or smaller deals, because also the consolidation is ongoing. And it is also possible that some of the market segments will become more diverse or more fragmented. And this might be also linked to the fact that in some countries the governments will try to control the infrastructure and prefer to keep the operators and the providers to be rather local than international. But we will see how this situation will develop. There might be countries who will take more liberal approach, and the others will be more restrictive in this regard. Let's move to slide 7, please. Yeah. Another interesting feature that we can see in a number of countries, the pandemic has demonstrated that the infrastructure, especially hospital infrastructure in a number of countries, is old and outdated, and couldn't cope with the big pressure caused by the pandemic. So we can see already in a number of countries that there have been discussions and considerations what the countries, what the owners should do with the infrastructure to update it and to be ready for another potential pandemic, which may strike at any moment. Also, as I said already, there have been discussions whether the government should control the so-called critical infrastructure, which includes also hospitals. And again, as regards e-health, I mean, there has been a discussion ongoing regarding e-health, how to make more use of e-health, because this might also help the whole healthcare system and make things better. Also, there is a big consumer convenience, so it might be very convenient for consumers, for patients to use certain e-health solutions. And as I said, Central and Eastern Europe in this regard is still a bit behind, and definitely there is some room for improvement. So that was just a brief introduction from my side. Maybe now we can move on to the panel discussion. And I would like to get back to COVID-19 at this stage, because obviously, I mean, it's a big topic and a big issue, and every healthcare provider is facing with the current situation. So my first question, actually, for each panelist would be, how has your company responded to COVID-19? What were the measures that you have taken, and what are the takeaway points from the current crisis? Maybe Dejan, if you could start.
Thank you, Thomas. Hello, everybody. Since it's first time, my name is Dejan Pešić. I'm the CEO of the Medi Group. As Thomas said, it's the largest healthcare platform, integrated platform in Serbia, and I would say also in ex-Yugoslavian region as the size. We are, yes, Thomas was right. We had 500 people 4 years ago. Now we are more than 1,000 employees, and double that size also if you count also the consultants. But yes, the challenge, like the whole world, we've faced this challenge. Let me be as short as possible. The main takeaways we have is that everything is in people and in organization. So what we did immediately, we formed so-called crisis teams, right, on each topic, one for internal communication, one for medical issues, one for financing needs. So these were the team. We increased communication internally rapidly. We've invested in safety equipment multiple times than before the COVID. Internal communication made very important part of our daily strategy. So we just communicated frequently to all of our employees, partners, and customers. We were, on the other hand, providing and securing cash and liquidity to provide for continuity of our business. So let me be short, and despite the COVID, we will have better results this than the last year, even though we were not included into the state-aided COVID model, largely present in Western countries. So which we will have one successful year behind us. And if you ask me how about now, I would say that in next 5 years period, we are back on our original track and plan. Just the market recomposed, but I guess we'll touch that base later in our discussion. I'm willing to discuss also on that topic.
Thank you. Maybe one follow-up question immediately. You mentioned that, I mean, you secured some additional revenue. So what was the source of this revenue in which particular area?
Well, let's say, I don't see, later we'll come to that point. I didn't want to anticipate maybe the future topics, but I would say that I would stay very high level at this moment, but I'm willing to come into deeper discussion. Okay. I don't see whole private sector as a loser. Who can be of the COVID situation? On the contrary, it opened many doors that wouldn't have been opened, or would have been opened much slower than in COVID situation. For example, opening of state for some sorts and kinds of testings for COVID wouldn't have happened in our media and scenario if COVID didn't help it. There are also some other opportunities which we are taking, but let's say that diagnostic is a great winner for a private sector, for large private homes which can afford it, large healthcare platforms, I mean. For the smaller ones who are much dependent on consultants, that was the trouble. So it struck them counterwise. But you told me you want to discuss that also later, so I'll give the chance to other participants.
Sure, absolutely. Thank you. That's very, very kind of you, definitely. So maybe Richard, how about Medicover? What was the response to COVID-19 and how did you deal with the crisis, or how are you dealing with the crisis? Because unfortunately it's still ongoing.
Thank you, Thomas. Hello, everyone. Yes, of course, it's still an ongoing situation. I can tell you about our experiences so far. It relates to the structure of our business, actually. So just to go back to a point you covered earlier, Thomas, with two divisions. One division provides diagnostic tests through laboratories. The other division provides healthcare services, and a large part of that is paid for in advance by companies for their employees or by individuals. So that's a subscription or an insurance service. And the remainder is fee-for-service, pay for the services you receive as you go. And there were a different impact on each of those sectors. So if you look at the fee-for-service area, this was a case where if it's a discretionary procedure, maybe like some dental work, people will think, I'm not going to do this during the crisis, I'm going to wait until the health situation is improved. So fee-for-service has a negative impact. In the subscription area, people have already paid for their care. So if there they decide to defer something, in the short term, that actually helps us until, of course, they come back and want to have that care in the future. And on the laboratory side, it's a mixture depending on how those tests come up. But in general, there's a need for more testing. And so that business actually has more work to do in this situation. And so we've been fortunate, because of the difference in our different sectors, to be able to have both pluses and minuses during the pandemic so far. How have we responded? First priority, as always, is to make sure that our patients and our staff have been kept as safe as possible. And so we've been investing in the procedures, in the disinfection routines, in all of the personal protective equipment to deliver that. The second priority has been to make it as easy as possible for our patients and our customers to continue using our services during the crisis. What we've done here is to increase very significantly the existing virtual channels that we had. So web chats, telephone consultations with doctors, those types of things. And as an illustration of that, if we look at the volume of consultations we were providing before the crisis, we found that roughly 1/3 of those our patients decided to defer until they felt safer. And another 1/3, instead of coming into our clinics, they were calling us or discussing on the web their needs. And in many of those cases, we were able to answer their questions, provide the help needed through that channel. And so our business mix changed. Between the first and second wave, that's come back somewhat. And now we're coming into the second wave, we're seeing those channels picking up a little bit more. That was the second priority. Third thing was to scale up our diagnostic capacity, particularly PCR tests for COVID. We've increased our capacity there roughly 4 times. So we can now provide a lot more testing, both for private organizations and for the state. And then the fourth area, as we come into the second wave in particular, where there's a lot more requirement for hospital capacity, is that we have been making our facilities available to the public systems. So we are now admitting COVID patients as well. Those have been the 4 main things.
Okay, that's been very helpful. Thank you. Maybe Ilian, if you could comment from your perspective. I know you used to be the CEO of the largest hospital in Bulgaria. Now you are focusing on rehabilitation centers, as far as I know, and long-term care centers. So what has been your experience from your perspective?
Thank you, Thomas. Thank you. Yeah, our portfolio companies are active in rehabilitation and long-term care, including senior care and care for elderly. We are active in Bulgaria, Greece, and we are just about to enter Romania. So what I will focus on, I'll not focus on the negatives of the crisis. I'll focus on the opportunities that came out during the crisis. And I'll make a comment on one of your points in your presentation about workforce, which is critical for all healthcare providers. Specifically in Bulgaria, what we've seen, because we are just opening our post-acute campus with about 430 beds in rehabilitation, nursing homes, skilled nursing, hospice, as well as home care. What we have seen is that because of the COVID crisis, a lot of the workforce that had gone from Bulgaria to Western Europe, particularly Germany, Switzerland, and Spain, had to come back to Bulgaria. So we were in the process of hiring nurses and caregivers and home assistants, and we realized there's plenty of supply because people have basically left their previous employment, and for whatever reasons, lockdown, they have to come back. So we were able to basically cherry pick some of the best people that are available on the market, and then it's now our job to make sure that we keep them, that we make a very good environment for them to stay. So that's one of the aspects, workforce. Unfortunately, in Greece, which is another country that we operate, we've seen migration of nurses from our facility or from a lot of private facilities to public facilities because people perceive there is a better security there. They've seen a hit, particularly on out-of-pocket patients in private facilities, and a lot of the nurses a lot of the nurses have decided to go there. On another aspect, COVID has posed exceptional opportunities for us, because right in the middle of COVID, we were able to acquire the biggest rehabilitation hospital in Greece from ESO Group, which is ultimately owned by Oak Tree Partners. So this, in the middle of COVID, people and companies decided to focus on their core business. ESO is a maternity and children's hospital group. So they decided that rehabilitation of non-core assets, and right in the middle of COVID, we were able to acquire a fantastic asset in Greece. Likewise, we are seeing two great opportunities in Romania that we are now running a due diligence on. These are distressed assets, and COVID has given us an opportunity to expedite our expansion to a large market like Romania. So for us, COVID has changed our strategic plans. One more thing that's worth mentioning is home care. Something that people have been talking about for the last 10, 20 years, that home is the hub of care. That actually started from big players like Kaiser Permanente in California. Now it's happening. We see it everywhere. And we as a post-acute care provider, because we have a workforce that provides a lot of the services, basically skilled nursing and home assistance, we believe we are much better prepared than acute care providers to enter the home care market. So we are currently developing our rollout in home care in all the 3 markets that we operate in. So a lot of the underlying circumstances have changed, but from an operator's point of view, it's a matter of adapting and reacting to the opportunity that COVID poses.
Thank you. Very interesting comments and perspective, actually. Maybe one additional question for you, Ilian. You spoke about home care. I also mentioned that during my initial presentation, that's definitely one of the growing areas. The question is, and you're for sure more knowledgeable about this than me, so I would like to ask you the question. If you think that this will also stay after COVID, and if so, to what extent? What are your expectations in this regard?
Yeah, I'm certainly partial, and I think it will stay after COVID and with much greater impact. So people were talking about the hospital turning into a big ICU and big operating room. So there's the hospital of the future, and I believe this is what's going to happen now. So acute care will stay for the most complex episodes, heart attacks, strokes, very complex operation, and people will, because of technology, because of people prefer to stay at home. I believe there is a great future for home care. So the whole healthcare paradigm will change in the future, and then certain services will be redistributed. But I believe that home care it's a great opportunity going forward, and more and more healthcare and social care and social services will be delivered at home.
Okay, thank you. Maybe also based on your comments, Ilian, I would like to ask a question to the other panelists regarding workforce, because you mentioned that, I mean, there has been a huge impact on your business, Ilian. How about Medicover or Medigroup? Have you seen any impact like that, what Ilian mentioned on your businesses? I don't know, Dejan or Richard, if you would like to discuss this.
Okay. Yes, if we speak about the Serbian market, I would say that we are still pretty well supplied in terms of medical stuff. In terms of there is a tendency, but since as you know we are still out of EU, it's not so easy to jump in terms of diplomas recognition or going in EU. So there is no such high mobility of workforce from our region to EU. But yes, there is such a trend. We are not suffering acute lack of resources, which is often heard in other neighboring EU countries due to migrations of the staff to EU, which is very easy to do. Here, I would say that we are well staffed, especially about doctors, specialists, surgeons, so at all of our levels. If I would say what could be the future potential area where we should, as a country, look better, maybe the nursing staff, which tentatively goes more easily to typically to Germany, let's say, from our side. But no, I wouldn't speak about the crisis of staff here. If you ask me about the management of private healthcare service, I would say that we are basically the market consolidators. So the others are still, there is a lack of talent in terms of admin management staff. So people are getting educated. We are creating that kind of people. So this would be one of the main challenges, but we are coping it with very successfully. We have people who learned here in 3-4 years. They became very capable, let's say, managers in our sector, but you don't see it around us, since typically the others are run by doctors, owners who created it. So there is no tendency to work as a corporation. We are the only one doing like that. So yes,
Okay.
This will be the challenge.
Okay, thank you. Richard, any comments on your side? How is your company dealing with potential staff shortages in countries such as Poland or Hungary or Romania?
We have around 30,000 staff. The overwhelming majority of those are medical professionals. And probably our biggest constraint on growth is making sure that we've got the people that we need. Now, that's always the case. There are particular issues in a time like the pandemic where, for one thing, you have to keep those people well and able to work. And it's not only those who are sick that's a problem, it's those who have to be quarantined because of exposure. So that's been an issue that we've had to put a lot of work into managing. We feel we've been pretty successful, but it's impossible to keep everyone as active as they would be at other times. And then, of course, our people are needed by other elements of the healthcare system. And in some countries, there has been pressure from governments to release staff for taking care of patients in the public system. So we've obviously respected that need, and we've seen to cooperate. But even after the pandemic, this is going to be an issue. One thing which I think will help, and we might talk more about in a minute, is the increasing role for virtual care, which does allow you to make use of your staff much more efficiently. For example, if you have an expert who is sitting in one city that can deal with a particular type of problem, in a physical system, they can only see people who are in that location. In a virtual system, they can see patients and consult patients from anywhere. So virtual care will help us to leverage our staff much more effectively. But I think we're going to talk more about virtual care in a few minutes.
Sure, definitely. Thank you. That's definitely an interesting topic we would like to touch upon a bit later. Maybe before I ask my other question, I would like to encourage everyone, every attendant. If you have any question, then please, you can use chat, or you can even let us know if you would like to ask the question live. We will let you in. We can organize that. And I can see we have some interesting questions already in the chat. So let's try and ask one of these questions. There has been a question asked by Marian regarding mental health. So she is asking, for the panelists having mental health care facilities, what kind of activities have been impacted by the pandemic and how? I was just wondering, do you operate any mental health facilities?
Yes, we do provide some mental health care. It's obviously part of the package of services which our employer customers expect us to provide, because it's one of the important elements of service for keeping their employees, fit, in good form, and productive. Some of those businesses we own ourselves, others we subcontract the provision to our customers to the third-party network. And we haven't seen a significant change in demand for those services through the pandemic yet, but my expectation will be that there will be more and more demand. And there was an interesting report, I think I read today or perhaps yesterday, that assesses that about 15% of people who have had COVID are subsequently coming up with mental health issues for which they need help. And so I anticipate this is an area which we will need to be scaling up our provision. In anticipation of increased demand.
Yeah, thank you for the comments. I think this has been a big topic, and just to make a bridge, yesterday during the panel discussion covering the Nordic countries, I think the panelists spent a lot of time discussing about mental health facilities and how they are increasing the capacity in this regard. So yes, I think this is something that is coming, and definitely for a provider like you, Richard, this is also an opportunity for future growth. I don't know about the other panelists, if you have any comments on this, Dejan or Rian.
I can only add that we are having also as in our facilities, especially in outpatient, so polyclinics and centers, we do we have the psychological service which we made online available to the public during the crisis as a help just to the public system. And I must say that it didn't give the response rate that we were expecting. There was not too much of interest for those kind of services, only let's say few calls per day, although we had prepared much larger capacities. So
okay, do you know why is that? Are people simply shy to speak about these issues in Serbia or in some other countries, or are the people feeling okay?
I think that it's a great novelty which needs some time to be accepted well and introduced. I do believe in the power of virtual space, health space, and we are preparing ourselves to jump into that. I think it just needs time, as every novelty. You don't have here the youngsters as early adopters in other tech industries. So it will take some time for the people to adapt and to start behaving, to try.
Okay, I see. But maybe speaking about electronic health.
I'll make a comment.
Yes.
We don't literally, we don't provide mental health services, but we provide services for behaviorally challenged people. Particularly, we do provide memory care services for people with dementia, and COVID has been extremely challenging. For one reason, I mean, there are regular operations that you have to amend to respond to the COVID in terms of infectious control and things like that. That has an impact on dining of the residents. And the other thing, what has been particularly challenging is the restriction on physical visits, because these people have used to have a regular interaction with their family members. And now that's not possible because of prevention and precaution measures. But that also, getting to one of the previous topics, is virtual visits and virtual communication. In our case, this is not virtual provision of services, but virtual communication and collaboration between the family members, the residents, and the caregiving team has increased substantially. So we do see significant growth in this area as well, where people used to communicate a lot physically. Now we see that people are getting used to communicate through a virtual environment.
Okay, that's very helpful. And I mean, speaking about virtual environment, obviously, some of you have already mentioned what you have done in this area, and this is a potentially growing area. I also mentioned during my initial presentation that yes, I mean, we see this as a potential, as a big potential also for healthcare providers. And now, since I mean, you all have a platform from which you can launch virtual health or e-health services, you are in a very good position to do so. So maybe if Richard, I mean, you touched upon that topic. If you could summarize what you have done already in this area and what are your next plan, because you can also, because you are present in a number of countries in the region, you can launch this platform quite quickly, I think, in a lot of countries at the same moment.
Yes, I mean, we were offering services like this before the pandemic, and the pandemic has helped both our customers and our medical staff to let's become, say, much stronger adopters of the idea. I mean, both have found it to be a better way of providing, fulfilling their needs than perhaps they were previously, ready to see. Now, I think it's important, though, to talk a little bit about what we mean by virtual care.
Sure.
Because there are different models in different industries. If you could let me give just a couple of quick examples.
Absolutely.
You compare Netflix to going to the cinema, right? That's a new way of providing the service, which has clearly been transformative. On the other hand, you can look at a model like TripAdvisor replacing travel agents. And there, it's not about the actual provision of the service, because you still need the hotel, the flight, the restaurant, but it's the way that the service is planned, chosen, and booked, which has changed. Now, those are both virtual business models, different from each other, and both different from healthcare as well, because it doesn't really fit with either of those. On the one hand, if you look at care provision, there are certain types of care that you can provide virtually, certain consultations, certain diagnostics, but there's still a lot which needs a physical interaction between the patient and the care staff. So you cannot have a complete transformation in that way. If you look at the planning, choosing, and booking aspect, again, healthcare is much more complicated than something like booking a holiday. It's not something you can do and then you receive the service. It's an ongoing interaction between the patient receiving some care, some diagnosis, that determines what the next steps should be. And so the idea that there could be a virtual care model which replaces traditional models just isn't going to work. What will happen is that both for the way we select care and the way that parts of the care are provided, the virtual care becomes integrated into the models. And our task as care providers, I believe, is to progressively do that, maximizing the way where both for efficiency and for the convenience of patients, more of what we deliver is delivered virtually, but it always remains closely integrated with the traditional service. And that's where having one platform for medical records, having one channel through which patients can book services, having continuity in those services which they've used virtually and with those which they've used in a physical way is so important. So big potential. It will definitely help us to overcome the challenges with limitation on medical staff. But in order to deliver, it has to be an integrated approach.
Yeah, absolutely. I agree. Tejan, any takeaway points from your side regarding virtual health?
No, I've commented at the beginning. Definitely the place where which will be developed. Definitely do not believe in a full substitution of physical contact, but I do think it can be very convenient and very good opportunity, especially for those countries like ours with a huge diaspora worldwide. To come back and to do the consultations in certain areas in a very trustworthy and convenient way. So yes, it's something that must be considered in the near future.
Is there, for example, anything that the governments could do better? Because, I mean, as I said during my presentation, I think many governments have taken quite a conservative approach to electronic health or virtual health. I mentioned the example of Hungary, and I recently learned that Hungary, in September this year, they significantly widened the scope of application of telemedicine, and they made some incentives. We could hear on the German panel yesterday or 2 days ago that the German government has decided to increase the level of reimbursement for telemedicine. So this could be perhaps the way to go. Speaking from my perspective in Czech Republic, I mean that the government kind of, or the health insurance providers kind of accepted that also healthcare services can be provided through virtual means, but there hasn't been any really incentive or significant incentive in this regard. So from your perspective, is there anything additional the governments could do to help promote virtual health services?
One thing is to facilitate through regulation what services can be provided remotely. So we now have in Poland ability to do e-prescriptions, and currently, at least during the crisis, to grant sick leave on the basis of an e-consultation. And we'll see if that remains possible after the pandemic. Now, for us as a private provider working in parallel with the state system for ambulatory care, that enables us to treat patients much more efficiently and safely. So that's been a big help. There is not yet the reimbursement of care services provided remotely in this market, but it does vary between markets. You mentioned Germany just now, where they start to do that. And another new innovation in Germany is that it's now possible to prescribe certain medical applications for patients and to receive a reimbursement for that. So I think in this respect, the German system is showing the way in a more innovative adoption of remote technology in support of healthcare provision.
Yeah, thank you for your comments. That's definitely quite inspiring, and that's perhaps where also our governments or the governments in the region of Central and Eastern Europe should look. Yes, Ilian, you also.
Yeah, Thomas, I want to make a comment because virtual visits and telehealth services, we as a provider of long-term care services and elderly care services, we've been at the other side. We've been at the receiving end of telehealth services. And actually, in this case, we can talk not only about provider to consumer, but provider to provider, because as Richard mentioned, for us, it was a way of much more safely receiving the services without having to transport our patients to a hospital or to an outpatient clinic for service. I mean, I'm putting aside the whole other collaboration aspects with the families that has been very important for us. But as somebody institutional who's been on the receiving end of the telehealth, I think that's been extremely good, because the whole situation has led to a much bigger receptivity, both on the resident side, the patient side, as well as the provider side. The subspecialists who are providing services to our residents have been much more willing to do so in this situation. So I do see as a general very positive trend being in this particular situation on the receiving side of the telehealth services.
Okay, thank you, Ilian. I think that's also a very important point that, I mean, we shouldn't limit only the telehealth services to the service that is made by healthcare providers towards the patients, but there is also an interaction on B2B side. Maybe as a reminder to the attendees, I mean, if you have any questions, want to ask something specific, please use chat in Zoom, you can ask question, or if you want to speak up, you can do so. Just let us know, and you can ask a live question. So, I mean, please feel free to do so. Don't hesitate to ask questions. We will be more than happy to provide a response. And just looking at the chat, there is an interesting question from Konstantin that actually already he's looking beyond COVID and asking about opportunities. So if I read the question, in your opinion, what will be the biggest growth options in the private healthcare in the CEE? Consolidation, extensive development to fill the gaps in state-owned infrastructure, or restructuring, such as changes in the size and composition of facilities providing different services, or any others? What will be the number one factor? So it's quite a long, interesting question, I think. Yeah. Any comments on that?
Yeah, from my point of view, the industry that we are operating, particularly the elderly care and the long-term care services, they present huge opportunity for consolidation. First, it's a relatively underdeveloped industry, and second, it's very, very fragmented. They're probably the biggest European operator like Orion and Orpea are just entering Czech and Polish market. So markets are very fragmented in almost every country in the region. The opportunity is huge. The demographics, underlying demographic factors in every country are just in place. The government infrastructure is very poor. Focus has been on acute care and public reimbursement. So we do see huge opportunity for growth in long-term care and elderly care in our region.
And when you speak about the region, is it Southeast Europe? So you're focusing at the moment at Southeast Europe?
Yeah, we are operating in Bulgaria and Greece, and now entering Romania. So it's Southeast Europe, yes.
Okay.
But I think that the same applies to Central and Eastern Europe as well, to the Central European countries, to the Visegrad countries as well.
Sure. So Richard or Dejan, any comments on your side regarding the number one factor and opportunities in the region in healthcare?
I think it's very hard to generalize. It matters a lot between which particular type of business. There certainly are businesses which there's potential for further consolidation. So to consolidate, they must be fragmented in the first place, and there must be an economic advantage of consolidating. So if you look at laboratories, for example, a bigger network can procure reagents more efficiently and can utilize its testing capacity more efficiently. So that's one area. Dental is another, where it's extremely fragmented at the moment. And as you build bigger networks of dental clinics, you can standardize processes and quality control. You can refer patients to the best centers for their particular needs. So that's an area where we are actually consolidating the provision in the Polish market. But there are also other sectors where there isn't really any advantage to consolidation. Within a sector of service provision, something that we think is very important is to be able to provide patients with access to the full range of services that they need. So you're not consolidating within a segment, but you're consolidating service provision across the full range of healthcare needs. And certainly there's still scope to continue with that.
Okay, thank you. Dejan, what is your point?
Thank you. Well, I would speak about XU region, and concretely Serbia is the largest market in Serbia, and surrounding countries still offers significant opportunities, growth opportunities in terms of expansion and in terms of consolidation. In Serbia as a central hub, together with Bosnia, Montenegro, I would say mainly in the areas of primary care and of diagnostics, both radiological and lab diagnostics, I mean. And that's exactly what the Medigroup is heading to do. And if you look that we are primarily the self-paid market, I would say that 90+% is still there. You can see a huge upside once public healthcare opens to private providers more largely than they do. Each year we do see steps from the government, in particular procedures opening step by step. So also now, as I said, they opened us for kind of testing. So I do expect also there a huge opportunity. So I would say, yes, filling the gaps, organic growth, there is a vast opportunity, but also consolidation in the region is something that shouldn't be underestimated.
Many thanks for your comments. It's good to see actually that there are plenty of opportunities. That's what we are also seeing, not just opportunities for consolidation, but other investment opportunities. I was interested to hear from Elian that he's looking also at distressed assets, which I think also going forward that might be further opportunities in this regard. Unfortunately, our time is up. I think it's been an interesting discussion. Looking at the chat, I think just to close and do one final round, I will use this question asked by David. Quick fire, one word answer question, as he calls it. One country in the region to invest in above all others, and one to avoid. Is there any recommendation on your side?
Yeah, I have a target region of 3 countries, which is Bulgaria, Romania, Greece. And if I have to rank, Romania is clearly number 1 in terms of opportunity at this point of time for senior care and elderly care. And I have no country not to invest because we are already investing in all the 3 countries that are in our target region.
That's a very good answer. Thank you. Richard, your comments?
I mean, if we have to answer based on countries, you know, there are attractive opportunities in all of them, but I do that on macroeconomic factors. So if we look at what the economists tell us about the ability to bounce back quickly from the crisis, country to invest in is Poland. It's got a strong economy and no dependence on natural resources. And so the economists say that this should be one of the fastest to respond. And a country to avoid within our region would be Turkey, where the debt repayments and currency and forex shortages mean that there are big macroeconomic risks.
Thank you. Dejan, any comments?
Yes, I agree with Richard's comments fully. That's something which is currently exactly as he described. I would just uncover a little bit the potential of this region where we do operate. What I mentioned just before, which is Serbia as a central hub together with some of ex-EU countries like Bosnia and Montenegro offer very good opportunities for investment. There is, of course, not at the scale of Poland, but very interesting ones.
Thank you very much for your comments. I think it's been a very interesting discussion. Thank you very much for your insights and that you have provided a very good overview of the current situation in Central and Eastern Europe, how you have dealt with COVID-19 and what are the future opportunities in the sector. So thank you very much to everyone. And with that, I hand over to Lee.